Our next speaker is Dr. Aparna Bapat, and she's an Ayurvedic doctor practicing in the United States for over 23 years. She's based in Florida, is on the board of AAAP and the president of Ayurvedic Association of Florida. Dr. Bapat is a very successful Ayurvedic practitioner and educator with vast expertise in Ayurvedic pulse reading, Ayurvedic cooking, Ayurvedic herbs, and Panchakarma therapies. Dr. Prana will be talking on herbal medicine to boost immunity.
Thank you, Dr. Renee, for introducing me. Today, I'm going to talk about herbal medicine and how to use various herbs to boost our immune system and to stop pandemic spread and also to reduce fatalities. So we can see that there are several things that we can know from a patient's health and where they stand in terms of their disease resistance. In Ayurveda, Ojas is considered to be the representation of Vyadhik Shamatva or disease resistance. So people can have inherent and acquired immunity. Some people are just born with a very strong mind, body, and constitution, and we call them with a strong Prakruti. They can have optimal Ojas right since birth. Some people are just born with this gift, and you can see that even in such pandemics like the COVID situation that we are going through, these people can, even in spite of getting exposed, either they remain asymptomatic or have very mild version of the disease. Some people have very optimally developed body tissues. They are called dhatusara. Their bodily tissues are very well nourished and strengthened daily with their lifestyle and diet and mental hygiene and all the good healthy habits that they have, so that the tissue doesn't become a host for nurturing any pathogen. The third type of people have taken some rejuvenative herbs or spices. They are called rasayanas, in the form of tonics or various formulations. Some of the popular ones are Chavan Prash, Amalaki Rasayan, Pipali Rasayan, Medhya Rasayan, etc. We also have a lot of emphasis about Ojas and a balanced Agni. So according to Ayurveda, any person who has a very successful digestive and metabolic cycle can develop a very well-nourished quality and quantity of Ojas, and that person can build or have a very good body resistance, can have a very good immune system, and this can be reflected in all the healthy 7 tissues of the body and the 16 strotas or the 16 systems that are explained in Ayurveda. In Ayurveda, we see that to develop these immunity in the Ojas in Dhatus and Strotas, there are specific immune boosting herbs. So I will just list according to the sequence here. Rasadhatu or the plasma tissue, we can use Guduchi, Amalaki, Haritaki, Tulsi. These have been very popular throughout this COVID pandemic times. In fact, the Ayush Ministry had also suggested the use of these herbs in form of herbal teas to use as a prophylactic measure. The second tissue is Rakta Dhatu, or which represents the blood cells, the white blood cells, red blood cells, and to keep this blood very strong and fortified so that it does not harbor any infection, we can use Manjishta, Kumari, turmeric. These are all immune boosting herbs for that specific tissue. Then we have the Mausa Dhatu, which is the muscle tissue. We can use Ashwagandha and Bala for that. For Medha Dhatu or the fat tissue, we can use Gugulu and Shilajit. For Asti Dhatu or the bone tissue, we can use Shallaki, sesame seeds. There are many more herbs. I'm just listing a couple of them as a sample. For Majja Dhatu, which is also a nerve and a bone marrow and represents stem cells, we can use Brahmi, Gotukola, garlic, Guduchi. These are all rasayanas for this tissue. For Shukra Dhatu or the reproductive tissue in the male and the female, we can use Shatavari, Kumari, Ashwagandha, and Vidari. And to generally to build up the Ojas or the boost the immune system and make our stem cells very vibrant and functional, we can use gold in form of gold infused water. We can use guduchi, which is a very adaptogenic herb. Amalaki and tulsi also can contribute by being adaptogenic and to boost the immune health. Now, if we try to look at the current pandemic, we have seen that the first entry of the virus is through the nasal pathway, and that is why we were asked to use mask and keep our respiratory system very healthy. Most of the Ayurvedic daily routine and lifestyle also encourages that. So anybody having a healthy lifestyle and a daily routine can definitely be using some of these things. One important aspect is if we try to boost the immunity of a particular system, that means all the organs, all the tissues, all the pathways in that system are going to have a strong resistance and resilience against any pathogen entering into that system. So for pranavahastrotas, we use a herb called pipali. Pipali or long pepper helps to strengthen the tissues, organs and the pathways of this entire respiratory system, which includes the lungs, the bronchioles, the nasal pathways and passages, so that any virus coming and attacking in that tissue can be dealt with there and there itself, and the spread can be controlled or minimized. For this, one very famous formulation is Vardhaman Pipali Rasayan, where we try to give an incremental dose of this particular herb, Pipali. It's a fruit, and you can see that in the picture. And this is given in the incremental doses of from 1st to 21st day, and then it is followed by decreasing the dose in the same sequence. This helps to boost the immunity in the pranavahasrotas or the respiratory system, and also strengthens the lung tissue. So this can be very well used for chronic conditions of the respiratory system, which include recurrent pneumonia attacks or chronic bronchitis, or even to as a prophylactic to save anybody having a weak respiratory system against any virus and other pandemics.
We have 1 minute.
The other thing is nasya. We can use vachadi tel that will coat the respiratory tract and also help to boost the immune system or immunity in those cells. Then we have the second thing that we need to take control is the plasma or the serum, because blood is the fluid tissue that carries all the pathogens to different areas. And so if we want to fortify our defense mechanism or within the cytoplasm, we need to avoid, and we can also avoid and minimize the multi-system or multi-organ failure that we had seen, and so many comorbidities happening in this current pandemic. To avoid that, we need to strengthen the blood and the plasma tissues. So we can use these specific herbs. One is guduchi, I had already mentioned, guduchi, tulsi, amalaki, turmeric. They all cleanse and keep the blood very strong in its immune system. Ashwagandha is also immunomodulatory and has been well researched, well documented for its anti-inflammatory action, which helps to boost immunity in the T cells, and also it helps to prohibit the cytokine storms that we had seen were killing a lot of people during this pandemic.
Dr. Bapati, going to wrap it up.
Yes. We can also use neem, and we can use the gold, which also helps to boost the immunity. So if we can keep the prana, tejas and ojas in a very good condition within the cell, and the vata, pitta and kapha, the energies in a very balanced state, we can definitely overcome any pandemic. And we can use variety of these herbs. A lot of them can be used on a regular basis, and some of them have to be taken, administered by a proper Ayurveda qualified professional who can guide you about the dosage and the duration of use.
All right, thank you.
Okay, thank you. You can get a lot of these herbs. I try to get it through my company, Ayur Spirit, and I have single herb formulations and multiple herb formulations which are authentically made in India. Thank you.
Thank you, Dr. Bapat, for a very insightful, in-depth presentation.